Hello, everyone, and thank you again for joining us today. My name is Shira Makhlouf. I'm a Director of Business Development at the Freemind Group. And today, towards the National Diabetes Month next month, we are going to talk about non-dilutive funding opportunities for diabetes. I'm going to present Freemind in a couple of sentences. Freemind is a consultancy that helps companies secure non-dilutive funding from US sources. As I said, today we are going to talk about some non-dilutive funding opportunities for diabetes, R&D in diabetes. We'll have enough time for Q&As at the end of the presentation. So let's get going. So talking about diabetes in numbers, this disease, the number of people with diabetes rose from 108 million in 1980, to 422 million in 2014. As I say, the global prevalence of diabetes among adults was about 8.5% in 2014. We're talking about a 5% increase between 2000 and 2016. Even in the US, we're talking about even a higher percentage, about 9.4 percent. About 1 in 4 people with diabetes don't know they have this disease, and we're talking about millions of people over the age of 18 that have pre-diabetes. Today, usually we kind of like to talk about three main three types of diabetes. Diabetes type 1, which you of course probably know. It's when your immune system attacks and destroys the cell in your pancreas that make insulin. It's an autoimmune disease. Type 2, when your body does not make or use insulin well. This is the most common type of diabetes. And also gestational diabetes that develops in some women when they are pregnant. Of course, there are other types of diabetes. The less common types include monogenic diabetes, of course, but today we're going to talk about those three types of diabetes. If we will kind of classify the field of research in the diabetes world or arena, we're talking about 5 different fields. Prevention, diabetes to occur in pre-diabetes population, diagnosis, and when we are talking about diagnosis, diagnostic is basically divided into diagnostic of diabetes patients and also early diagnostic of pre-diabetes patients. Also, we're talking about monitoring the disease and adjusting the diet accordingly, managing the disease, the treatment of the disease, of course, and also complications, mostly skin, such as diabetes ulcers, eye, foot diabetic foot, neuropathy, kidney disease, and stroke. All of the above are and could be funded through non-dilutive funding sources. So when we are looking at basically the stages of development that could be funded, we see that the NIH, or the sources that I'll present in a second, basically fund everything from discovery stage and up until phase 2, phase 3, even clinical trials. The sources that we are going to talk about today fund not just drugs or pharmaceuticals company or R&D, but also medical devices. So basically any type of solution that is relevant for diabetes could be funded through the sources that we are going to present today. The size of the awards can start from a couple of hundred of thousands of dollars and can go up to over $3, $4, $5 million. It's really a reflection of your needs, and of course it has to do with the stage of development that you are at. So the main funding sources in the US for diabetes that we are going to talk about today are under NIH, the National Institutes of Health, NSF, and the US Army. Obviously, there are other private foundations that could be relevant, that could fund diabetes projects such as JDRF, and there is the Diabetes Association. I'm not going to talk about them today. Obviously, one should find a specific opportunity that fit their R&D activity. But today we're going to talk about the governmental institutes. So NIH, as you probably know, is built of 27 different institutes. Basically each institute is dedicated to a couple of indications in the life sciences or a specific field in the life sciences. For diabetes projects, we're talking mainly about the NIBIB, the National Institute of Biomedical Imaging and Bioengineering, and this is obviously more are relevant to medical devices, but also NIDDK, the National Institute of Diabetes and Digestive and Kidney Diseases. Overall, the total funding in the US is about $60 billion a year. Most of it comes from the NIH, about $42 billion a year. Yeah, let's break it down. So let's start with the NIH. Now I'm going to show you some NIDDK opportunities, funding opportunities for diabetes and also for complications of diabetes. This is, for example, a perfect example of one of the NIDDK funding opportunities. This is an classic R01. It's in an investigator-initiated clinical trials targeting diseases within the mission of NIDDK, which is obviously diabetes. Since it's an open R01 under NIDDK, one can submit any type of project under this. Of course, it has to do with diabetes under this opportunity. We see here that the budget is unlimited. Typically, we're talking about $500,000 a year for 5 years. So about 2.5 up to $3 million in total. And this opportunity has rolling deadlines throughout the year, 3 rolling deadlines actually. The next one is on February 5th, 2021. The next one is for pain. We talked about neuropathy, so neuropathic pain. It's also by the way under NIDDK. It's mechanisms, models, measurement, and management in pain research. One of their focus area is neuropathic pain. Obviously, that is relevant for diabetes. Again, this is a classic R01. Clinical trials are optional, so you can submit an application for preclinical work, but also for clinical work as well. So we're talking about basically unlimited budget, about $3 million, and same next deadline, February 5th. Here you can see an example for wearable smart devices. This is again under NIDDK. And this funding opportunity purpose is to develop tools and devices that can continuously monitor the range of hormones for, let's say, for diabetes, for example. The budget here, since it's an R21, it's for more, let's say, early stage development. So we are talking about $275,000 over a 2-year period. When I mentioned basically the budget, especially under NIH, I'm talking about direct costs. On top of that, one can add a certain percentage to cover the indirect costs as well. The next deadline here, since this opportunity doesn't have a rolling deadline, since it's a more specific solicitation, the next deadline is June 8, 2021. And unlike the other opportunities I showed earlier, this is open for US entities only. This is an example for kidney diseases, which, as I said, is one of the complications of diabetes. It's an R21, so again, it's for more early stage development. The budget is about $275,000. The deadline here, since it's a kind of a more open, I would say, R21, this mechanism has, or this funding opportunities has three rolling deadlines throughout the year, and the next one is in February 16th. Another interesting opportunity is this is actually for diet. assessment activity. This is, well, diet and physical activity assessment methodology. This is, for example, for the management of the disease and managing the diets as a consequence of the disease. This is a classical R21, same budget and same deadline. Well, unlike the opportunities I showed you, well, just now, and all of them are under NIDDK, this is a classic example from NIDIB, the National Institute for Bioengineering and Bioimaging. This is the Bioengineering Research Grant. It's an R01, so the budget is higher, again, about $3 million for 5 years. The purpose of this funding opportunity is basically to advance multidisciplinary bioengineering approach to the solution of a biomedical problem. So obviously medical devices within the diabetes field could be funded through this funding opportunity. So I showed you up until now, I showed you some specific opportunities. Some of them were more open than the others. Some of them were more specific solicitations. But this is an example for parent announcement, the NIH Research Project Grant. This is a parent R01. And as you can see here, there are many institutes that participate in this funding opportunity. To be more specific for diabetes, we see here NIDDK, we see here NIBIB. But if, for example, one would like to fund their R&D for the complication of diabetes, so let's say, for example, one of the complications are blindness. So if, for example, you have a kind of a research or a project to better understand why diabetes cause blindness, then it should go under NIDDK. But if you have a research on blindness, then you should go to NEI, which is the National Eye Institute. So all of those funding agencies participate in this call or this funding opportunity. So you can submit any type of application on any type of project under this funding opportunity. Since it's an R01, the next deadline is February 5th. As I said, 3 rolling deadlines throughout the year, and the budget is up to $3 million. I would like also to mention that about 2/3 of all the awards come from unsolicited opportunities, such as this one. Another opportunity that is parent announcement, so that means that many institutes participate in it, and it's not a specific solicitation, you can submit it for any type of project, is the Omnibus SBIR. SBIR, as you probably know, is Small Business Innovation Research. It's open only for US entities and SBIR eligible organizations only. The funding here, which includes direct cost and indirect costs, is about $256,000 for phase 1 and about $1.7 million for phase 2. Obviously, there is fast track as well, which includes phase 1 and phase 2 altogether. So we're talking about a budget of about $2 million, if of course it is relevant to your stage of development. So up until here, we talked about NIH and their funding opportunities. Now I would like to bring one of the NSF's funding opportunities. So this NSF funding opportunities is Small Business Innovation Research Program. This is for phase 1 and phase 2. The purpose of this funding opportunity is to fund the development of deep technologies, and deep technologies refer to technologies based on discoveries in fundamental science and engineering. One should submit a project pitch, and you can do that basically anytime. And then you need to be invited to submit a full application. So if until now all the funding opportunities I showed you require to submit a full application without let's say a pitch beforehand, here you need to submit a pitch as a first step. And if you are invited to submit the full application or the full proposal, you have a window between September 4th until December 3rd. Then, of course, we expect another window of opportunity or another window to submit an application to be open towards in 2021. Now, if you received a phase 1 award, so obviously in order to submit a phase 2 application, you need to win a phase 1. So if you won any time between March 15, 2018 until December 3rd, 2018, that means, of course, that 2 years passed since then, and you no longer get basically the money from this grant, then you are eligible to submit an application for the SBIR phase 2. So I will, basically in summary, this funding opportunity could fund medical devices only, that of course has to do with the diabetes. Another great funding opportunity is under CDMRP. CDMRP is the Congressionally Directed Medical Research Programs. It's under the Department of Defense, and this program is dedicated to the veterans and their family. It comes out every year, once a year, towards the springtime. And this funding opportunity or funding program covers many applications in the life sciences. Basically, it could start with, oncology, infectious diseases, but they also have specific, let's say, more focused opportunities. Diabetes is one of them every year. This is the solicitation for diabetes. As you can see here, they also look for treatment, of course, for the disease, but also they focus on the complications of the disease, including diabetic neuropathy and wound healing. So if you have a project that basically in this field, you could use the CDMRP opportunity to ask for funding. As I said, this program comes out only once a year in the springtime, so we expect it to be issued towards March, April 2021. And I'm happy to say that the budget here is unlimited. This program covers early stage R&D through advanced clinical trials, could fund also more advanced clinical trials than the NIH, for example. So we're talking about phase 2, phase 2B, phase 3 clinical trials. And I guess that's the reason why the budget is unlimited and should be a reflection of your needs. So now that we've talked about funding opportunities, I want to give you some submission tips. Of course, once you have a solicitation that or a funding opportunity that that could fit your project, you should read the solicitation carefully. Make sure, for example, that it is open for, if you are a non-US entity, so make sure that it is open for non-US entity. Choose the right topic and funding opportunity. Remember the pre-application, or in this case, for example, I mentioned the NSF pitch project you need to submit, but also, by the way, under CDMRP, you need to submit a pre-application before you are invited to submit the full application. So it is definitely a critical part of the process. Make sure that your team is registered ahead of time. Sometimes the registration process could take let's say about a couple of weeks. So make sure you don't wait for the last minute before you register, and keep track of the key dates, because as I said, there are funding opportunities that have specific deadlines, and there are funding opportunities that have rolling deadlines. So you need to make sure that you know what is the date for submission and for pre-application and full application, etc. Now, how you maximize the chances of award. You seek insight into the interests and goals of the funding agencies. We really recommend people to talk to program officers before you submit an application to make sure that your project fits their interest and what they're looking to fund. Make sure that if, for example, you didn't understand the solicitation completely, talk to program officers beforehand, again, so you won't prepare a full application and then realize it's not a good fit for you. Stay the course and ensure to correlate the granting strategy with your long-term R&D plan. The funding opportunities I showed you today, and I think all of the funding opportunities in the US, they fund near future R&D activities. So we're talking about, let's say, a year or two from now. So when you submit an application, make sure it correlates with your granting strategy and your long-term R&D plan. And know your weaknesses. So for example, if you need to find a partner in order to strengthen the application, don't be afraid to do so. So what we do in FreeMind, once we work with a client, we identify all the relevant funding opportunities for them for each one of their projects. Then we create a multi-submission granting strategy, because we know that, you know, at the end of the day, it's a numbers game. The more applications you submit, the better your chances are. And that's definitely our goal in engaging with a client. And then we help a client submit as many top quality applications as possible. And that's about us and about the funding opportunities for diabetes R&D. Let me know if you have questions. I'll be more than happy to answer them right now. Okay, let's see. So as for the slides, thank you, David, for your question. We are going to send you a link for the YouTube recording, and also we're going to send you the slides, so hopefully by tomorrow. So as for our business model is based on success. We charge an award fee and a retainer, and there is a trade-off between them. And I'd be more than happy to share some more information about our business model. So if you'd like, please contact me directly and we'll set up a call. Any other questions? Okay, so I think this is it. Thank you so much again for joining us today. As I said, we are going to send you a link for the recording and the slides. Thank you very much and stay safe.